Hello and welcome to Docplexus News. Let's discuss this week's healthcare headlines that matter. MCI is in the process of finalizing the MBBS bridge course for BDS students, which will enable them to practice as MBBS doctors. This proposed 3-year course is intended to address the shortage of doctors in rural areas and provide additional employment opportunities to BDS students. MCI will first need to address a number of issues regarding the course content, internship and registration of these students. Now, central government employees can easily avail benefits of the Central Government Health Scheme from private hospitals. The Health Ministry has revised this scheme, which will benefit 45 lakh central government employees. This new rule has eased the referral protocol to a private hospital and also made some of the treatment procedures free of cost. The Karnataka state government has proposed an independent regulatory authority to probe into medical negligence by doctors. The Karnataka Health Minister, Mr. K.R. Ramesh Kumar, said that the government does not want any discrimination and any patient can complain against government and private doctors. The Delhi High Court has directed the central government that steroid skin cream should not be sold without a doctor's prescription. This decision comes after a petition filed by the Indian Association of Dermatologists, Venerologists and Leprologists. The plea also demanded a high-level inquiry on the CDSCO approvals for the commercial manufacture, use and sale of steroid combinations. To decrease the number of drugs and toxicity, FDA has approved the first 2-drug regimen for certain HIV-1 patients. The fixed-dose tablet contains dolutegravir and rilpivirine. The approval is based on 2 clinical trials which demonstrated the safety and efficacy of this 2-drug regimen. Changing the thrice-weekly regimen for tuberculosis, the Health Ministry has launched a daily regimen for TB patients. Now, fixed-dose combinations of 3 to 4 drugs will be given in a single pill instead of giving multiple tablets. This new regimen will reduce the pill burden on patients and reduce the incidence of resistance and relapse. To promote awareness and acceptance of male sterilization, the Union Health Ministry has launched a Vasectomy fortnight from 21st of November to 4th of December. Under this initiative, male sterilization services are being provided in public health facilities. This initiative, which is being observed in all states of the country, is intended to increase participation of males in family planning. Ignoring all studies in favor of e-smoking, the Union Health Ministry is planning to issue an advisory warning against these products. The ministry advises placing e-cigarettes in the category of flavored hookah. The warnings will further include that e-cigarettes are harmful to health and they have never been approved by the Union Health Ministry. The government is planning to make amendments to the Drugs and Cosmetics Act 1940 to introduce a compensation provision. According to the amendments, pharma companies will have to pay compensation for injuries and damages caused to patients by their products. Under the existing law, the companies are liable to pay compensation only for undesirable effects of drugs during clinical trials. Recently, a health initiative conducted by ICMR revealed the alarming status of disease burden in India. As per this report, the life expectancy has significantly improved from 1990 to 2016, but the disease burden has undergone a radical shift. A quick look over some of the significant findings from this report reveal that India has the highest incidence of TB in the world. 6 out of 10 people die due to non-communicable diseases and 6 million children die before the age of 5 due to malnutrition. This initiative is intended to help the government and policymakers to improve health programs planning in India. In this regard, we urge our community to give their valuable opinions about what amendments should be brought by the government to tackle these ongoing health issues. These were the latest happenings in the medical field brought to you by Docplexus, India's largest online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!